a common question that comes up for veterans in the VA disability process is, can I file a secondary condition, and how does that work? Yes, you can absolutely file a secondary condition if you're eligible. I'm going to talk about that here in this video. But first, I'll say that I do have some experience doing this. I think I have applied for 2 and have been granted service connection for 2 different secondary conditions. And I also have some family members and friends who have been in this process that I've helped out, and they also have been successful in doing this. It is a little bit more complex than doing something direct service connection, but it's possible and certainly something that you should go for. If you're interested in learning where this information is at in 38 CFR, it's in 3.310, which I encourage you to read it, but I'm going to go over my understanding of this section of the code, and just based on some of the experiences that I've had with myself and some of my friends and family. So first of all, if you look at this graphic here, it shows that medical conditions or disabilities that we have can cause other conditions to become worse. In this scenario here, it looks like we have a knee problem, a knee condition that eventually caused back pain. So, that's kind of the roundabout way that, this works. It's cause and effect. It's one condition over time causing another condition. And although I'm not a doctor, I would say that, if you have a knee problem and it causes you to walk funny, walk differently than how you normally would, eventually it's going to cause back pain. But I encourage you to do some research on that to make sure that, that's accurate for you. But this is a common condition, secondary condition that's claimed as long as you have the right evidence. So, based on what I've learned in this process, the VA is going to need to see different things in secondary claims. They're going to need, they need things to satisfy the requirements that the VA has to have a secondary claim. One. And the first thing is that we still need to have a current diagnosis for the secondary condition. So in this case, the secondary condition that we're claiming is lower back pain, or whatever the cause is for our lower back pain. Is it arthritis? Is it degenerative disc? Is it, what is it? Whatever it is. So that secondary condition, you must have a current diagnosis for it from a doctor. All right. And then you need to have an existing service-connected condition. So you need to have something that the VA has already told you that you are connected for. So in this case, knee pain. So let's say you got, let's say you have arthritis in your knee and the VA service connected that for you, 10, 15 years ago, whatever the case is. And now you believe that it has caused you to have some sort of lower back issue. And so you have those two things. And then you must have some sort of, evidence to show that there's a nexus between the two conditions. And as you can see in the chart there's that bridge and it's broken. If you don't have that bridge, then you don't have the evidence to support it. So we need to have evidence that bridges that gap. And, obviously a nexus from a doctor, like saying, hey, these two conditions are connected. They've reviewed your medical records. They understand the condition that you have that's service connected. And, the doctor's able to provide that information in your medical notes, using facts from, whatever facts a doctor would need to use, science-based facts to show the reason why they believe that the two conditions are connected together. And at the, they need to quantify that to a specific level. So the VA likes to see at least as likely as not. If it was more likely than not, then that would be a little bit better than at least as likely, but less than likely, then obviously you wouldn't win. Some benefits to a secondary condition, although secondary conditions in my experience have been a little bit tougher to prove because a lot of times you need to get something more than just finding, your diagnosis or something in your service treatment records to where you complained about it or, you got diagnosed while you were in the military. In this case, you're not, you don't have that. So they're a little bit harder to get approved. But the benefits are they can certainly increase your overall rating, which, means more, a bigger compensation paycheck each month. It also helps give a better picture of your overall disability so that you kind of understand, why, what's going on with your body. I think the biggest mistake that most veterans are going to find with this is just not being able to prove the connection with evidence. I think one of the things that veterans struggle with is trying to find the evidence that bridges the gap, right? Like, it's a little difficult to walk into your doctor's office who's been treating you for this and ask your doctor to write up something in your medical notes to help you with this, assuming that, that it's, factual and accurate. Doctors probably don't like to do that. But there are ways to get your doctor to help you out, if they're willing to, but that can be a big challenge. You can also look to get a medical opinion or a nexus letter from a doctor that specializes in it. However, they do charge, anywhere from probably $500 and up. So that sometimes that's a challenge, fronting the money for that when you don't necessarily know that your condition's going to be approved after paying that. But at the end of the day, this is a secondary condition, and you absolutely can file a claim for them and get it approved, assuming that you have all the evidence.